I am joined by Kal Patel, and we're going to talk about the challenges of hiring in a digital health startup, basically. So Kal is the CEO and founder of BrightInsight. And yeah, I mean, just kind of over to you, really, Kal.
Well, thanks for having me, Cristian. It's a pleasure to be here. Yeah, happy to do a quick intro. As mentioned, Kal Patel, I'm CEO and co-founder at BrightInsight. A quick background, physician MBA by education, my way through Boston Consulting Group, working across both US and Europe in pharma, medtech, payers, providers. And then was at in pharma industry itself. So I was at Novartis Pharmaceuticals in the US, and then joined Amgen, was head of corporate strategy there, global marketing lead for their main drug, Enbrel, and then founded and led what we call Amgen Digital Health. So one of these early digitally focused groups within big pharma medtech, and that really started my passion and focus around digital health and what technology can do to really disrupt and advance healthcare faster.
Fantastic. And I suppose when looking at your time at BCG, obviously your time at Amgen, and of course at Novartis, huge companies, no doubt lots of responsibility. What made you kind of take that leap of faith, I suppose?
When I got into that role at Amgen and started to see what technology could do for healthcare, it became clear to me that the technology revolution that had largely changed every other aspect of our lives had skipped over healthcare education and government. And I've had a lifelong passion around healthcare. And so at that point, for me, it was really around how can I help harness the power of digital technology to advance healthcare faster. And I thought, the best way to do that was actually from sort of the outside, partnering back with industry versus just being within the formidable, great legacy players, because really their scale and capabilities are focused on different things than what digital can do to advance. Certainly at the time that I made the leap.
Looking at maybe kind of scaling up from there, I suppose what would you say were the main kind of challenges in actually kind of scaling up just from that kind of smaller size?
In this job market, and frankly in any job market, hiring the best talent and retaining them is always a challenge. Right? I think in digital health, we actually do have some particular advantages, right? The first one is around mission. I think people really want to work and really do their life's best work at a place where they can have massive impact. I think we have a real competitive advantage as a result of that at BrightInsight and what we're really driving within the broader digital health ecosystem. Secondly, I think you have to build an advantage through your culture. Is this a place you want to go and work at every day, right? Is this where you want to go and sort of pour in your energy and your passion? And if you can create the kind of culture where people are super excited to jump out of bed and come collaborate with their teammates, feel every day that they're doing something that's meaningful, that they're delivering not just impact at a company level, but at an individual level, and can really be developing their own skills, et cetera. That culture piece is super critical. And you have to think about that early on. It's much harder to change the culture of a company as you scale, right? And so to your point around those early days, we, I think, had a culture that we established that worked really well for us and very authentic and continues to permeate the company, as we've scaled from, like you said, 20, 30 people a couple of years ago to over 200 now.
Yeah. And was that hard to keep together in a pandemic as well, I would imagine?
Yeah, the pandemic for sure, it's been a challenge for everyone. So, what we really focused on, first of all, is just really hiring based on sort of time zones versus geography. So now in the United States, over the last 2 years, we've sort of spread out to having employees in about 30 states. And I think we're up to about 11 countries. And so folks, really collaborate using digital tools like Zoom and others, Slack, et cetera.
I've heard from people that you do lots of initiatives and meetings, et cetera. I mean, I think it was something called the BrightInsight Week. Tell me a little bit more.
It runs from 8 a.m. to noon Pacific time for an entire week. And those 4 hours in a typical day are divided up between, an hour of sort of company presentation strategy, what different areas are working on, what the key objectives are for the year. But then we'll have an hour of typically talking to an external speaker. It could be a board member, it could be a customer, it could be a patient, it could be other important stakeholder. we spend an hour doing entertainment. We've had everything from magicians to incredible musical performers to comedians, come on. And then we'll usually share, existing customer programs and what those are and how they work, right? So we sort of create this program where it's substantive, where people are really learning a lot, but also there's really driving affiliation and collaboration.
Yeah, no, absolutely. That's fantastic. And I think it's clear that you guys have really thought about it and kind of accelerated that through the pandemic as well. Now is kind of, this period at the moment is kind of coined as the Great Resignation. Have you seen a lot of people leave BrightInsight, or have you been a beneficiary?
We've been a beneficiary for sure. The bar is going up, right? And so that includes for what we need to do to ensure that we, again, retain and engage and create a great environment for our existing talent. But I think as you said, we've been thinking about that a lot. We've been focused on that before the sort of quote unquote Great Resignation came along. And so I think we're just kind of investing in building on the momentum we had, which both helps us, minimize from a resignation perspective, but also capitalize on people who are, now much more open to a new employer. And we sort of encapsulate, like the example I gave in a program, in an approach that we call home first. That's kind of our internal language for how we think about how people come to work, right? So we're sort of identified at a company level, hey, we are a home first environment, knowing that people are going to, primarily be working out of their home to be able to really design, again, an environment from a culture perspective, communication perspective, supporting each other from a physical and mental health perspective, et cetera, right? We have, for example, mental health days. So once a month, the whole company shuts down to take advantage of that. We have various fitness challenges that we do throughout the year that create a lot of teamwork and again, a lot of fun bantering and get people moving. We use an app called Donut, which basically is integrated into our Slack, that every week randomly assigns you to a different person in the company to have a virtual coffee with.
These are great ideas that I've never heard of Donut before, actually. But that's fantastic. I think if you, like you say, you've got hundreds of employees and randomly been assigned to somebody, I think that's great. Any things to cover in terms of what advice maybe you would give to other kind of CEOs and founders within digital health, early stage companies on scaling teams and retaining those teams?
Yeah, that's a good question. A lot of advice to offer my younger self, new startup CEOs. But from the people side, it may sound obvious, but I think the biggest advice is really focus on getting the right people, the best people sort of on the bus, if you will. Especially when you have a lot of job openings you're trying to fill and the market's competitive, it's very easy to get yourself convinced that somebody's sort of good enough, and really focus on, is this the best and right person for what you need and what you're going to need for the next phase of growth for your company. And that obviously is not just about skills, but it really comes down also to values and fit. But I think if you can make the right decisions from a people perspective, that has an incredibly multiplicative cascading effect, because that's the person that's going to then hire their team, and then those people are going to hire underneath them, right? And so getting those people decisions right is so critical, especially in those early days.
Yeah, no, that makes sense. Yeah, it's that kind of like trickle down effect, I suppose, isn't it? Then building teams as well. I suppose that's testament to obviously the success that you guys have had, so far. And I mean, it has been a rocket ship success, really, hasn't it? I know I read recently, of course, that you guys have brought Sanofi on as a partnership. I mean, what's next for you guys in terms of like the next 18 months? Other great success stories to tell.
Thank you. Yeah, it's been a super exciting time. I mean, look, I think over the last couple of years, we've done 3 fundraisers, with some of the world's premier investors like General Catalyst and Insight Partners. Our BrightInsight platform, we partner with pharma and medical device companies to help them build regulated software solutions. So as you mentioned, we recently announced Sanofi as a major customer. We have other great public logos like Roche and CSL Behring. And we have more announcements coming. So we're going to have, I think, another customer announcement here coming fairly soon. And then we have a portfolio of customers that we haven't yet publicly announced, but look forward to their products coming to market and then being able to do that, right? So I think we're I would say on our way to our goal, which is really to become that de facto platform on top of which pharma and medtech companies build regulated software solutions.
Wish you all the best. Thanks so much for joining us here and answering these questions. And yeah, thanks a lot, Kal.
Yeah, thanks, Christian.